Immediately, I responded to the WalkAide, and I was just so exhilarated and happy that my foot was actually functioning like it's supposed to.
Call it a miracle? I sure did.
I put this on the first time. In the first 5 minutes, it's doing what I can't. That's amazing.
When she runs is when I really see the difference. I've never seen her run so stable and so easily.
People say the term foot drop. Essentially what they're alluding to is the fact that patients have difficulty raising their foot. Most commonly, and this is what we're alluding to when we talk about foot drop, it's due to an injury to the brain or the spinal cord. And that's what's unique about WalkAide and these functional orthotics, is that not only are they compensating for the patient's deficits, they actually help with neuromotor recovery. I think it's incredibly liberating for a patient to get out of their big bulky brace a lot of times and be able to walk barefoot for the first time, be able to wear flip-flops.
We get feedback all the time from patients who tell us that this device has changed their life. It's allowed them to walk more normally. It's allowed patients with MS to continue in their jobs without feeling different from their coworkers. It's allowed patients that have had strokes to rehabilitate themselves. Some patients even have walked out of the WalkAide.
The WalkAide system is a highly sophisticated Class II medical device available with a doctor's prescription only. WalkAide was originally developed at the University of Alberta, and after a decade of testing and refinement, it received marketing clearance from the FDA in 2005. As a result, thousands of people, both adults and children who struggled with foot drop, have found new freedom and independence with the use of the WalkAide system.
Kids or pediatrics are a lifetime patient, if you will. And if you can avoid one surgery or one additional muscle atrophying because of the use of our products, it's a win-win for everyone involved, the parents, the child, and ourselves, as well as the physician who's managing the care of that patient.
The WalkAide is very effective for treating foot drop for conditions with upper motor neuron lesions. Typically, you will always get a good signal because their nerve below the knee is intact. WalkAide gives people hope, inspiration, and a second chance at life.
The WalkAide is a dynamic treatment system that uses functional electrical stimulation, or FES, to restore nerve-to-muscle signals, prompting the foot to lift at the appropriate time. WalkAide enables more efficient walking for longer distances, on uneven surfaces, up and down the stairs, and even sidestepping.
You really can use this device on more challenging patients that have weaknesses in multiple joints, and if you just give them some time, you can really see some things that will just amaze you, that you would never be able to give with an AFO.
While AFOs, or bracing, may help to stabilize the foot and ankle in foot drop cases, they may not help restore a normal walking pattern, nor do they engage the existing nerve-to-muscle pathways. WalkAide, on the other hand, is very effective for treating foot drop caused by upper motor neuron injuries or lesions, and, as clinical research indicates, it helps improve walking speed with less fatigue. The WalkAide was cleared by the FDA for the treatment of foot drop due to multiple sclerosis, stroke, cerebral palsy, traumatic brain injury, and incomplete spinal cord injury.